Legionnaires' disease complications. Definitions. Legionnaires' disease is a potentially fatal lung infection that is caused by Legionella bacteria. Legionnaires' disease is caused by breathing in small droplets of contaminated water. It is not contagious and cannot be spread directly from person to person.
Legionnaire's disease is caused by a type of bacteria called Legionella. The bacteria got its name in 1976 when people at a Philadelphia convention of the American Legion suffered from an outbreak of the disease. Although this type of bacteria was around before 1976, more illness from Legionnaire's disease is being detected now. Each year, between 8,000 and 18,000 people are hospitalized with Legionnaire's disease in the U.S. However, many infections are not diagnosed or reported, so this number may be higher. More illness is usually found in the summer and early fall, but can happen any time of the year. Legionnaire's disease can have symptoms like many other forms of pneumonia, so it can be hard to diagnose at first. Signs of the disease can include a high fever, chills, and a cough. Some people may also suffer from muscle aches and headaches. Chest x-rays are needed to find the pneumonia caused by the bacteria, and other tests can be done on phlegm, as well as blood or urine to find evidence of the bacteria in the body. Symptoms usually begin 2 to 14 days after being exposed to the bacteria. A milder infection caused by the same type of Legionella bacteria is known as Pontiac fever. The symptoms of Pontiac fever usually last for 2 to 5 days and may also include fever, headaches, and muscle aches. However, there is no pneumonia. Symptoms go away on their own without treatment and without causing further problems. Legionnaire's disease can be very serious and can cause death in up to 5 to 30% of cases. Most cases can be treated successfully with antibiotics, and healthy people usually recover from the infection. Legionella bacteria are found naturally in the environment, usually in water. The bacteria grow best in warm water, like the kind found in hot tubs, cooling towers, hot water tanks, large plumbing systems, or parts of the air conditioning systems of large buildings. People get Legionnaire's disease when they breathe in a mist or vapor that has been contaminated with the bacteria. The bacteria are not spread from person to person. Outbreaks are when 2 or more people become ill in the same place at about the same time, such as patients in a hospital. Hospital buildings have complex water systems, and many people in hospitals already have illnesses that increase their risk for Legionella infection. Other outbreaks have been linked to aerosol sources in the community, or with cruise ships and hotels, likely sources of the bacteria having come from whirlpool spas, cooling towers, and water used for drinking and bathing. These are just a few things to know about Legionnaire's disease and how to protect your family. For a list of indoor air quality professionals and resources, please visit the website shown on the screen.
Applications in medicine. Legionnaire's disease is treated by antibiotics or to kill the bacteria. Possible antibiotics that may be used include clarithromycin, fluoroquinolone. These may be taken by mouth as tablets or capsules, or they may be given through an intravenous infusion. An intravenous infusion is where the medicine is given in the hospital by continuous drip through a narrow tube into a vein in your arm.
Legionnaire's disease is caused by a type of bacteria called Legionella. Clinical features include fever, dry cough, shortness of breath, tiredness, headache, and muscle pain. In severe cases, respiratory failure and even death may occur. Persons aged over 50 years, those with weakened immunity and chronic illnesses such as cancer, diabetes mellitus, chronic lung or kidney disease, those taking corticosteroids or drugs that suppress body immunity are at higher risk. Legionella bacteria are found in sources of water. A person can develop Legionnaire's disease by breathing in contaminated droplets and mist. To prevent the infection, one should avoid smoking and alcohol drinking, as well as to prevent bacterial growth in water. Remove strainer filters. Wipe all surface dry. Ensure no stagnant water. Change the water inside the device daily by first emptying the water tank, then wiping the surface and finally adding water. Persons with weakened immunity when drinking, toothbrushing and mouth rinsing should use sterile water or cooled freshly boiled water. Avoid using humidifiers or mist generating equipment. For more
Pros and cons. Pros. You can use tests to discover the disease on time. Legionnaires' disease can be diagnosed using an urine test. The Legionella bacteria shed proteins called by antigens, which can be detected in an urine sample. Further tests such as blood tests, a sputum test, or a chest X-ray may be recommended to assess the effect of the infection on your overall health and organs such as lungs and kidneys.
Legionella is a gram-negative bacilli named after an outbreak among people attending a convention of the American Legion. Although the bacteria is characterized as a gram-negative bacteria, it is often difficult to visualize due to poor gram staining. It requires special medium for growth called charcoal yeast extract. Legionella requires special medium because it requires the presence of iron and cysteine to grow, which is not in common blood agar media, and can be readily visualized with silver stain. Legionella is known to be water-loving and transmitted via inhalation of mist droplets containing bacteria. Common sources include cooling towers, hot water systems, and fountains. Individuals that are smokers, over 65 years of age, and heavy drinkers are at moderately increased risk of disease. In patients, the organism is commonly detected in the urine using the Legionella urinary antigen. Legionella causes two distinct forms of disease, including Legionnaire's disease and Pontiac fever. Patients with Legionnaire's disease typically present with high-grade fever with chills and occasional diarrhea and vomiting. Lab tests can show elevated liver enzymes with hyponatremia.
To get notified of new videos.
Cons. In particular, severe cases of Legionnaire's disease, a number of life-threatening complications can occur. These include the lungs are unable to provide the body with enough oxygen, respiratory failure, the kidneys do not work, which can lead to a dangerous buildup of fluids and grace in the blood, kidney failure, a blood infection leading to a sudden and dangerous drop in blood pressure, a septic shock. Issue apply in Ecuador. In Ecuador has increased the numbers of smokers for this reason to increase the risk of developing this disease. Smoking damages the lungs, making you more susceptible to all types of lung infections, are 50 years of age or older.
Most importantly, and thank God, it is not contagious disease. In other words, cannot be passed from person to person.
Conclusion. In conclusion, the essential thing is avoiding smoking is the most important thing you can do to lower your risk of infection. Smoking increases the chance that you will develop Legionnaires' disease if you are exposed to Legionella bacteria. Thank you.